Hey y'all, Kayla Mowdy, Doctor of Physical Therapy here. Today I'm going to talk about low back pain and some general education and advice that is evidence-based and that everyone who has back pain should know. Unfortunately, there are a lot of people in the medical field, even physical therapists, who are not quite on to this education that I'm going to give you today. They may not know the newest research. The newest research is actually between 5 and 10 years old, but for some reason, there's a lot of people who have not been exposed to it, and there are still people educating patients the wrong way. So here is what evidence says is the wrong way to educate a patient with low back pain. Promote extended bed rest, provide in-depth pathoanatomical explanations for the specific cause of the patient's low back pain. I relate this to the explanation of the MRI. You get an MRI and you have this bulging disc and this bulging disc and this herniation and this instability and all these big bad words that the patient really doesn't understand, and that creates fear. So, and then another thing you should not do is to tell the patient how bad their back is, because that's also going to create that fear. What you should do as a physician, as a healthcare provider, as a person approaching someone with low back pain or approaching your own attitude towards low back pain, almost everybody, 80 to 90% of people will experience low back pain at some point in their life. It usually has a very favorable cause. It usually goes away. It's usually a small incidence. Our bodies are amazing. They can heal. But if you do get into this cycle of fear and avoidance and bed rest, it will get worse, not better. So here are the things you should do. So emphasize the understanding of the anatomical structural strength inherent in the spine. Y'all, our backs are strong, whether you work out or not. God made us to have these really strong ligaments, and the discs are not just little squishy donut things. They are strong, reinforced with layers and layers of strong tissue. You have multiple joints. Your entire back doesn't just ride only on those discs. There's facet joints, there's ligamentous attachments above and below. There's this huge fascia that goes all the way from the buttock muscles to the arm muscles. It's all connected and strong. So understand that you didn't hurt your back, you didn't go out of place. There's not this huge big problem that a lot of people see in their minds. Even just now I was Googling some things, and there was these pictures of these people with these red spines and bending over and holding and these inflammatory things that just look really bad. And that's what people have in their mind when they hurt their back, when it may just be a very small thing. So the neuroscience that explains pain perception, so that is the video I shared last week. So I will post the link below and post the link to this evidence that I'm reading here for y'all to better understand how the brain perceives pain. Usually when an area is hurting, the brain pays more attention to that area and it hurts more, and it pays more attention and hurts more. Then the third thing, to explain the overall favorable prognosis of low back pain. So almost everybody will have back pain at some point in their life, but not everybody dies with back pain. So generally our bodies recover, especially if we have these right mental approaches to the problem. The next one is the use of active pain coping strategies that decrease fear. So that's what I'm talking about here. Self-talk, it's okay. This isn't that, that big of a deal. Everybody gets back pain. Let's keep going. The early resumption of normal activities. So that's the next thing. And the importance of activity levels, not just focusing on pain. So if you're always focusing on pain, the pain is going to be there. Some things that we teach in physical therapy to help with back pain management is activity pacing, attention diversion, cognitive restructuring, these education points here, goal setting, always thinking about the functional stuff. What can you do? Let's do what you can do. Graded exposure, finding exercise and activities that don't hurt, and teaching your brain that it's okay to move normally, and that once those muscles around that are coordinated and your body goes through the healing process, 2 to 6 weeks is how long it takes for tissue healing if you did have an actual tissue level injury. And then maintenance strategies, things that you can do in the future to prevent future flare-ups of the problem, and also problem-solving strategies. Let's think through the way you sit at work. Let's think through this activity that you did while you were getting hurt. Let's figure out what led to the problem and address that so that you don't end up with this chronic pain and fear of doing activities. And then the thing I want to end on is that MRI does not correlate with symptoms. That's something I really appreciate about my physical therapy education is we are taught to listen to the patient, listen to the history of the problem, listen to how the problem responds to activity, and to focus on those things and teach the patient activities that they can do to get better and to continue with their daily lives despite back pain, and back pain will resolve. It doesn't need injections and surgeries and stuff always. Sometimes it just needs a little bit of activity modification or some education or just some reassurance that everything's going to be okay, because the time that you spend up here telling yourself it's not going to be okay is not good for your body. We are learning the neuroscience behind pain, and it's very, very much connected to what goes on up here. And stress, a lot of people who have high stress levels have high pain levels, and it's really hard to break people out of that cycle, but that's what I love doing. I love reassuring people that it's going to be okay. You're not gonna live with back pain for the rest of your life, so please don't let a doctor tell you your MRI looks horrible, you really need this surgery, or oh my goodness, I can't believe you're still walking around with this horrible back. Just know that your back is strong and God gave it to you to last the rest of your life, and stay active and healthy and fit. And if you do end up having a problem, please come see me or another trusted physical therapist in your area. Y'all have a wonderful Monday. I'm sorry I went a little long. That was a little bit of a rant. My grandmother went to a doctor last week, and they told her back looked horrible, and really kind of frustrated me, so I wanted to touch on these things. I will post the links to these articles. They're all medical jargon, but they're at least some really, really good resources if any physical therapists are watching this, or doctors, or really anybody who wants to actually educate themselves rather than just taking everybody else's word for it. Bye.